webinar on abstract writing. We're just going to give everyone a couple of minutes to join and then we'll begin. Thank you so much for being here. For a webinar, we'll just give another 2 minutes and then begin to just give everyone some time to join and get settled into the webinar. Thank you so much. I'm Sangeeta Chatterjee, the Research Director at SVRI. Thank you so much for joining us today. I'm so glad to be here today to talk to you about the SVRI Forum 2026 and our abstract review guidelines. Before I talk about the forum, let me share a little bit about SVRI for those of you who are not familiar with us. Next slide, please. So the SVRI was founded in 2003 by a small group of researchers and practitioners who recognized the deep inequity in how research on violence was funded. At that time, most resources sat in high-income countries, while very little research was being done or led by researchers in low and middle-income countries. Over 20 years later, a lot has changed. We've grown into a network of more than 13,000 members like you across the globe, building and sharing evidence to end violence against women and children. Our work is about strengthening the space and amplifying underrepresented voices, promoting equitable partnerships, and influencing change through the evidence we build together as a field, as a community. And the SVRI Forum is where all of this comes together, where research, practice, and partnership meet, and where the global field connects to learn, share, and collaborate. Next slide, please. The SVRI Forum is a 5-day event that brings together researchers, practitioners, funders, policymakers, and activists from across the world, all committed to ending violence against women and children. Next year, we're going to meet in Bangkok from the 5th to the 9th of October, and it's shaping up to be our biggest and most inclusive forum yet. Monday will open with 23 workshops selected through an open call process with lots of opportunities for deep learning and collaboration, followed by our opening and welcome event. From Tuesday to Thursday, the forum abstract driven program happens with plenaries and parallel sessions, all built up from the abstracts we have received. So definitely don't forget to get your abstracts in, and we'll share the deadlines with you soon as well. We'll feature a range of different kinds of talks, from 4-minute talks, posters, and dialogic sessions shaped directly by the field through a pre-forum survey that we sent out on a weekly update. Friday will round off the week with participant-driven events, which provide a lot of time for reflection, sharing, and connection. These are driven by participants based on their interests, and you can sign up for these as well. And throughout the week, there will be art, film, wellness activities, and celebration because joy, creativity, and care are part of what sustains us as well as this work. Next slide, please. So every time we have the forum, we have different themes. And this year, our themes reflect the breadth and depth of the field. They range from understanding root causes and strengthening prevention and response strategies to exploring how technology both perpetuates and prevents violence. We'll also look closely at strengthening the science itself, thinking about research methods, thinking about scaling up practice based knowledge, and how we can use research for both advocacy and policy change. And at the heart of it all is one goal: building a healthy, connected, and ethical evidence ecosystem. Next slide, please. What makes the forum unique is how it's created. It's entirely co created by the field. Themes, panels, and events emerge from our collective priorities. And equity and justice are embedded throughout in our speaker selection, bursaries, visa support, and inclusion of early career researchers like you. Forum and everything that we do at SVRI is trauma informed with wellness spaces, counseling, and other services woven throughout the event. And as I said before, we make plenty of space for joy through art, film, and celebration. Next slide, please. And now we come to the meat of today's webinar, abstracts. So abstracts are how people from across the world bring their work, perspectives, and innovations into the forum, and they shape who is on the program. And for Forum 2026, we are accepting three types of abstracts. Research abstracts are for presenting new evidence or findings, whether qualitative, quantitative, or using mixed methods. Programmatic or practice based abstracts are for sharing program design, implementation experiences, monitoring or evaluation experiences, basically capturing what you did, what you learned, and why it matters to the field. And this year, we have a new format, panel abstracts, where we encourage you to bring together 3 to 5 submissions on a shared theme. These work best when they draw on different projects or programs and allow for multiple perspectives on an issue to encourage discussion. And we are accepting abstracts in 3 languages, in English, Spanish, and French, because this is about creating a global conversation and it's not just a conference for us. Next slide, please. So abstracts are reviewed against clear criteria that you can see on the screen to ensure that the process is open, fair, and transparent. Each submission will be peer reviewed by at least 2 reviewers using the selection criteria we have set out. Reviewers will assess the relevance of your research or program, how it connects to the themes of the forum, how it addresses evidence gaps, and contributes to either improving responses or the prevention of violence against women and children, or how it builds the science of our work. They will also consider the quality of methods and approach, ensuring that the research or program is credible, ethical, and grounded in evidence. For research based abstracts, reviewers will also examine whether the study design, sampling, and analysis are appropriate and whether ethical approval has been obtained for your study. For programmatic abstracts, reviewers will look at whether implementation, monitoring, or evaluation approaches are clear, whether they are based on a sound theory of change, and whether there is evidence underpinning the program. Abstracts will also be assessed for their significance. The so what, in terms of findings or lessons, and how they advance our understanding or practice, as well as for their contribution, the what next question, particularly how the work moves the field forward, especially in resource limited settings in LMICs. Your abstract should therefore clearly outline what you will be presenting, how it builds and advances knowledge on the topic, how it influences or informs policy or practice, and how it connects to a forum theme or a research agenda priority, whether the research agenda is regional, global, or thematic. These criteria reflect our values of rigor, equity, and usefulness to the field. And I also have the dates up on the slide. So our abstract submissions are currently open and they will close on 30th January 2026 with notifications in June 2026. We'll now invite 2 of our past abstract reviewers to share their experience of the process of reviewing abstracts. Our first reviewer panelist is Elizabeth Leroux. She's a research director of the Unit for Religion and Development Research at Stellenbosch University in South Africa. She's a research and technical consultant with almost 2 decades of experience working on and leading projects in multiple country contexts around the world. Our second reviewer panelist is Marceline Machisa, who is a senior specialist scientist at the South Africa Medical Research Center Gender and Health Research Unit, who is also an honorary associate professor at the University of Witwatersrand, senior lecturer at the University of KwaZulu-Natal, and co-director of the Global Campus Violence Prevention Network. She has over 15 years experience researching the intersections of mental health, violence against women and children in Southern Africa. Thank you so much for joining us today, Lisa and Mercy, and sharing your valuable time with us. So I'm going to ask my first question to Lisa. What are the first things you look for when you're reviewing an abstract?
Hi everyone. Thank you for having me. Okay, so the first things that I look for when I review, is there a clear research question? What was the research question? And what methods were used to answer that research question? I must say, when I read that's my two big things. Because for me, it's fundamentally important um, to get it to be clear on that. Because if the methods were inappropriate or inadequate, then whatever the findings were or are, that's not reliable then. So I always start by looking the research question, or sometimes it's framed as an aim, and that's fine,
Mm,
but the
yeah.
methods. So yes, while findings are important, I actually look first to see if there was a fit between the research question and the methods. So I do realize though that the SVRI abstracts are difficult with a 350 word limit, and I've written many of them. It kills me every time. Um, but if the abstract can't explain what it aimed to achieve and how it did that, so the research question and the
Mm.
methods, then I don't think it's a proper abstract. But Sangeeta, I'm going to add one more thing. You asked for what's the first thing I look for, but there's two key things.
Sure.
Is the so what? So in other words,
Yes.
is this actually important? Is it actually relevant? Why does this matter? Because we can do a lot of research. You can do a whole study on, are red sweets better than green sweets or whatever? And I can see your research question and I can see your methods, but I will be wondering, like, why is this important? Why does this matter? So also the abstract must make super clear
Mm.
why this research and its findings is important, and to make sure that your abstract really communicates that. Um, Now, I've been talking a lot about research abstracts, and we have the PBK ones, the practice-based knowledge ones as well. The logic is the same, though, with a slight angle to it. I would say, as a reviewer, it must be clear for me what you did. So, for example, what was your intervention? And it must be clear to me why you did what you did. So,
Okay.
again, yes, I will look at the findings, what was achieved, but what did you do and why did you do it remains, like, that needs to be very, very clear. If I don't
Sure.
fully understand what you did and why you did it, then I can't begin to understand your PBK and the relevance and legitimacy and robustness of it. So
Thank
that kind
you.
of creates a framework.
Thank you so much, Lisa. And I'm going to hand over to Mercy now. What are the common mistakes that you see in abstracts that often lead to rejection?
Thanks, Sangita. So for me, I think it's not being able to manage the space that's available to you. That's what makes many abstracts to be rejected. And so, for example, when you think about your background section, you don't need to over explain the gap. You just need one statement, problem statement, or one statement that talks about the gap you're going to fill. Similarly, when you write up the conclusions, you don't want to be giving claims that are overreaching beyond what you have presented in terms of your findings. And just to build on to what Lisa was talking about in terms of the so what, if you have minimized your background and then you minimize also your methods, you don't need to really explain what a focus group discussion is, right? You just say we did 5 focus group discussions. If you are a
Yeah.
quantitative person, you just say you did structural equation modeling. You don't have to take us through like the steps of your methods. You just need to name them and the reviewer will
Yeah.
know what is the method. So you minimize your background, you minimize your methods, then you have space for your results and findings. And as Lisa is saying, because you have that space, you don't just leave your findings as being descriptive, but you
Mm.
make the connection about the significance, the so what, and in that you place your abstract in the context of perhaps the track you are applying for. So it shows that this is useful. So yeah, I think I'll leave it there for now. Yeah.
Yeah. Thanks so much. And Lisa, how do you think authors can strike the right balance between clarity and depth in a short abstract? Because that's, of course, very challenging, and
Mm.
you touched about it a little bit earlier.
I think this now connects to what Mercy just said, or at least for me, it connects to what Mercy just said. So yes, it's challenging. You only have 350 words. But my number one tip for striking that balance is to make sure that you address all of the headings that are specified in the abstract platform. So with the research abstracts, it tells us background, aims, objectives, methods, results, recommendations, and what gap in a research does it address. You have to cover all of those. If you ensure that you are covering all of it, and like Mercy said, you don't have to make a big song and dance about your methods. It's fine just to say 7 focus groups and 12 interviews. Stop there. But if you're covering all of those, then you know there's clarity there. It's then we can see what you did, why you did it, what did you learn from it, why is it important. Again, same logic with the PBK abstracts. Make sure you hit all of the points. So they tell us evidence and practice-based learning for the program, who the program involves and how they're involved, forms of violence, who delivers the program, length of the program, gap in practice does it address? Like they tell you. So make sure you address all of those. I think if you cover all those headings and it should be clear what you did and what you learned from it. And I think that will actually determine your depth. You will see if you're heading all of those, you can't write that much. You do it a little bit by, making your methods as short and clear as you can. But that's actually going to give you the guide around how much, because you just can't do that much if you're covering all of those. Yeah. So I think that's what I would say. Thanks, Sangeeta.
Thank you so much, and really valuable advice on making sure that you sort of address all the essential criteria of abstracts, which has been clearly outlined on the conference website as well. And lastly, to you, Mercy, for our last question, if you could give just one golden rule for writing abstracts, what would it be?
That's a challenge to say one. I'll wrap two together. So the one is that do not copy and paste an abstract from somewhere else and just click send. You still need to edit it for the audience. So don't repurpose, because then it becomes too general to make any sense to the people that are reviewing it. So that's one. And then the second one is don't wait for the last minute to come up with your abstract. Just like you do with your papers, give it time, work on it, and allow space for peer review. So you've got senior people, co-investigators you're working with, you've got your other peers. Just as you do with your papers when you're submitting them, write it up and then get other people to peer review. That helps you to kind of figure out the places where you need to improve it, so that by the time you submit, it's a winning abstract.
Thank you, Mercy. And I'm also going to ask Lisa the same question, like very quickly, rapid fire style. What's your one golden rule for writing abstracts?
So when you've drafted it, make sure that it clearly answers 3 questions. What was done? Why does it matter? What are the key findings? As a reader, I mustn't have to go and look for that. It must stand out. That would be my golden rule.
Great. Thank you so much, Lisa and Mercy, for sharing your valuable guidance and your time with us. We really appreciate it. Thank you so much. And I will now hand over to Astha to guide us through the rest of the webinar. Thanks so much, Astha.
Thank you so much, Lisa, Sangeeta, as well as Mercy. I hope all of you are doing well and you have learned some critical tips as well as pointers on how to draft your SVRI abstract. I am going to share my screen. 2 seconds, please. Sorry. Bear with me. Okay, so Good morning, good afternoon, good evening, and maybe good night to everyone. I am delighted that this session has shown so much interest, and I just wanted to give a brief background to myself. My name is Asta Ramaya. I am a assistant scientist at the Bloomberg School of Public Health at Johns Hopkins University. But today I am talking as a past bursary recipient for the SVRI Forum 2 years ago. And I'm also talking in the capacity of a co-facilitator of the Gender Violence Collaborative Network. My research focuses very much on how gender as a power system affects health outcomes, but specifically violence during adolescence and how that intersects with sexual and reproductive health as well as mental health. So, just a brief background. The Gender Violence Collaborative Network is currently supported by SVRI. It is a feminist led grassroots initiative that brings together early to mid career researchers committed to ending gender based violence. We envision a world where emerging scholars, as well as practitioners, are empowered, supported, and actively connected through a dynamic global community. The GVCN supports researchers as well as practitioners at all stages of their careers, fostering well being, collaboration, and knowledge sharing across experience levels as well as geographic boundaries. This workshop, as Sangeeta so nicely outlined, aims to reduce the barriers as well as build confidence amongst early and mid career researchers, particularly from low and middle income countries, to write clear, compelling abstracts. Our goal is to increase the chances of presenting their work, but also getting the chance to be at the SVRI forum to ensure that their voices are represented in global violence conversations. So I just wanted to open it up. I realize we have a lot of us, but I just want you to put maybe in the chat what you think is an abstract. And I know Sangeeta gave a really nice overview, as well as both Mercy and Lisa told us what an abstract is. So if you were to say in one word what you think is an abstract, could you put that in the chat for me, please? I can't monitor the chat, but I see that there are responses coming. So I will continue. An abstract is essentially, it is a standalone summary. It is something that can be read by itself and allow the readers to know what it is you did, what it is you are focusing on, what it is you found, and why this matters. It usually gives a description of the program or the research. And I usually like to think about it as an elevator pitch. So it is, if you were to get on an elevator within 2 minutes, would you be able to relay all of the above? So why you did it, what did you do, what did you find, and why this matters. Yep. Now, the first thing that you put in an abstract is your title. And it is the title that the reviewers see and determine whether they're excited to read your abstract or already skeptical. So let's look at what formula I have used to write a compelling title. For a very good title, you have to make sure that you outline what your specific population is. You have a clear method or approach. You have a clear outcome or a dependent variable in research. And then you tell us in which context or where it is happening. So these are the 4 key components that make up a strong title. Here, I give an example. The first example is peer violence prevention study. We don't know what population this was done under, what kind of violence it was, what was the prevention approach, where it was done. The second one says gendered patterns and determinants of peer violence trajectories amongst adolescents in Kinshasa, DRC, a longitudinal study. So here we have the population, which is adolescents. We have the method, which is the longitudinal study. We have the outcome, which is peer violence. And then we have the context, which is Kinshasa, DRC. Now, remember, your title must be under 25 words or less. So make sure you count those words and make sure that the words you add to your abstract all matter. My second point is try to keep it as simple as possible. Can a 7-year-old and an 80-year-old understand what you are saying through that title? Third, be specific. Say peer violence and not violence. And then lastly, include your setting if you think it is important. You can include rural, urban, clinical, community, amongst refugees, amongst community members. Yeah. So now, given what I have just presented, I thought we could practice together. These are 3 titles that I put together. A study about women in violence, community program results, and healthcare worker training. Can you propose how any of these titles can be improved? You can put it in the chat, and please remember the specific population, your clear method or approach, your key outcome, as well as the context. I will give people maybe 1 to 2 minutes to think about, you can just choose one title and say what you would change. Would you change anything about it? And if you would change something about it, what you would change it to? Okay, so now we go into, Joyce, I see your hand up. Can you put your question in the chat? And I see someone else's hands up. Can you put, if you have questions, can you put them up? Can you put them in the question and answer section? Or can you type, yeah, can you type what you wanted to ask? Thank you. So now we think through, as we know, SVRI has 2 tracks. One is the research track. The other one is the program and practice track. And for the research track, the background, and I've put like ranges here, but for the background, think about what is the problem that you want to answer and what is your specific research question. The second section is your methods. And within your methods, I urge you to think about the study design, the participants, the setting, what were the measures that you used. So what was your independent variable? What was your dependent variable? And then, of course, what your analysis was. Remember that your methods should be directly linked to what your research question is, similar to what Lisa had outlined in the reviewer panel discussion. For the results, what you should be focusing on are your key findings. So provide, if it is a quantitative study, provide what the specific numbers are, what the percentages are, what the associations are. If it is a qualitative study, outline what your key themes are and provide the examples. If it is a mixed method study, make sure you think about which quantitative as well as qualitative results answer your research question. Yeah. And then lastly, you have the conclusions. And this is what both the reviewers said is the so what. What are the implications of your results for policy, practice, as well as future research? Now, the second one is structuring a strong program or practice abstract. And within that, there is a little bit of change in the structure. We start off with the background, which addresses what the problem was or is. The second is the program description. And here, you should talk about what it is you did, where it is you did it, and with whom you did it. And then, of course, why it is you chose this topic, the place, and the population. Yeah. For the outcomes and the evaluation, you can talk a little bit about what worked, what didn't work, and if you have a preliminary data or if you have data, providing the evidence about what worked, what didn't work, and most importantly, if you have that data, why it worked or why it didn't work. Yeah. And then, similar to the research, where we have the implications and the conclusion section, in the programmatic section, you think a little bit about, you talk a little bit about the lessons learned. And the lessons learned essentially give an overview of what the implications are and what the next steps are. Now, I thought this would be helpful. This is more like a quality checklist that I usually use when I'm writing my abstracts. And the must-haves are, you have a clear research question or a program objective. You have a specific methodology or approach that is described. You have concrete results with outcomes, usually numbers or themes or the combination of both. You have a practical implication that is a result of the results, that is a result of the results that you are finding. And then you should always make sure that you address this through the equity as well as intersectionality lens. The technical requirements with Sangeeta went through so nicely. Make sure that your abstract is 350 words and no more. Make sure your title is 25 words. You don't need references. You don't need tables. You do not need figures. And please, please, please make sure that when you are submitting your abstract, you try to minimize the grammar and the spelling mistakes. It is really nice that SVRI offers abstract submissions in in Spanish, in French, as well as in English. And so if you feel like your English is your second language, like it is mine, uh, try to get, or those are not your first languages, try to get someone whose first language is that to make sure that there are no grammar or spelling mistakes. Yeah. And then my don't do's. And these are completely based on what I think make or break an abstract. So try not, don't be vague. Don't inundate your entire abstract with just background without sufficient methods and results and implications. Don't miss the methodology. Please don't miss the methodology. Don't have an overarching conclusion that is not related to what you found. And please make sure that you always keep track of your word counts. Yeah, you don't want someone to just reject your abstract just because you had 351 words instead of 350 words. Yeah. So now I thought, given that you have learned all of this from all of us, I thought it would be nice if you could be reviewers. And what I did, what I tried to do, is I tried to put together a mock abstract, and I wanted to open it up to all of you to read it. And maybe what I can do is I can read it, and then you can take maybe a minute or 2 minutes to say what you think works in this abstract and what you think doesn't work in this abstract. So I can read it. The title is Community-Based Intervention to Reduce Violence Against Women. Violence against women is a serious global health issue that affects millions of women around the world. Previous research has shown that intimate partner violence has many negative consequences for women's physical and mental health. There are many risk factors that contribute to violence against women, including social, economic, and cultural factors. We conducted a study to examine the effectiveness of a community-based intervention program designed to reduce violence against women. Our study used both quantitative and qualitative methods to collect data from participants. We recruited women from the community who had experienced violence and provided them with various services and support. Our findings showed that the intervention was successful in many ways. Participants reported improvements in several areas after participating in the program. There were also some challenges that were identified during the implementation process. These findings have important implications for policy and practice. More research is needed to better understand how to implement these types of programs in different settings. Our study contributes to the growing body of literature on violence prevention. So, you can type it in the chat and tell us what you think about this abstract. And you can talk about any parts of this abstract, what worked, what didn't work, and if you were a reviewer, what questions you would have. And I can maybe give you about a minute. Okay. So for me, when I was looking at this, what I thought was the title, firstly, was not as specific as I would have liked it, because it talked about violence against women, but it didn't talk specifically about which type of violence against women. It didn't talk about what context it was done. It didn't talk about the population that was included. I also thought that the background was a lot, and it gave, rather than getting directly at the gaps and what this research study was going to focus on, it provided a lot of background information. For the methods, I was wondering how many participants they included, what was the intervention, where it was conducted, and so maybe a little bit of details around that would have made the method section better. For the results, they say it was successful, but they don't outline why it was successful and in what way it was successful. And so it would have been nice to add, like, what were the challenges they faced, what were the successes they faced, and providing specific examples. And then for the discussion, I felt like it was very overarching, and it was very much related to it was very vague, similar to the title, where they were just saying that we need to understand how to implement these types of programs without threading it all together and taking what they found from the results and putting the implications within the discussion section. Yep. So I am nearly at the end of my presentation, but one of the things that I would like you to do as your next action steps is give you a concrete action plan for writing your abstract. So the first step is draft your title. The title will guide everything else and help you stay focused. The second step is think about what your research question is, and maybe that research question is based on the results that you have. So the results are, if you can't write compelling results, it becomes really hard to convince the reviewers why the work that you are doing matters. I would also encourage you to use the SVRI website for examples. So review the previous year's programs, find abstracts that are similar to yours, and study their structure. See what they had done and what they did, like what they had done to be included. Yeah. And lastly, this is due in January, which is actually not that far away. One of the things that I always do is I share my abstracts with colleagues who are part of the team, but also with colleagues who don't really know, who know what work you're doing, but don't really know the specifics of what you are proposing. And so share your abstract with your colleagues and see what feedback they provide so that you can incorporate it into your abstract. Yeah. And then, of course, my summary slide, which is make sure your title is specific and compelling. Make sure the structure that you follow includes a background, the methods, the results, and the conclusion. Be specific, not vague. Address the reviewer criteria, which is relevance, clarity, methods, as well as significance. And start with the title and the results and work backwards so that you have a very compelling research question and methods, which makes a very compelling abstract. So this is my last slide. I will stop sharing here. And I think I will pass it on to Sabrina to open up the question and answers.
Hello, thank you so much, Asta, for such a wonderful presentation. I always love learning from you because you always highlight these really important reminders for the abstract writing process. Thank you everyone so much again for being here today. Thank you as well to SVRI and our two reviewers, Lisa and Mercy, for joining us and giving us some insight. So we have a bit of time now. We've got about 10 minutes for some Q&A. I'm just going to start off while we wait for some more questions to pop up in the Q&A section of Zoom. And just also a kind reminder, rather than putting them in the chat, please use the Q&A function. That just helps us keep them all together. But before I do that, I just want to summarize on some of the questions that were asked throughout the presentation, just in case you might have missed them. So there's a few questions around abstracts being submitted based on conceptualization, or if you didn't have all of the data quite yet. So regarding conceptualization only, you can submit an abstract that is theoretical as long as it is advancing the science on violence prevention and/or response. In terms of submitting preliminary findings or pilot, you can definitely do so. You can do that from ongoing work. Protocols are accepted, but they're more likely to be accepted as posters rather than oral or 4-minute presentations. Ideally, we'd like to see some results in the abstracts, and for research presentations, we need to see that the ethics and safeguarding review has been done. Posters are, however, super popular at the forum, and they offer a really excellent format for sharing and developing ideas and receiving construction feedback. At the last forum, they had 189 posters. So also just to say as well with protocols that you need to note that studies with results, or at least preliminary results, will be prioritized over protocols. There's a lot of questions regarding bursaries for travel and accommodation for those in need. And there will be applications for bursaries. SVRI will be announcing those soon. So we encourage you to sign up to SVRI's newsletter or follow them on social media channels from when those will be announced. Still, though, of course, we encourage you to submit abstracts for research that has been completed or is near completion before you apply for the bursary. I think that kind of covers a lot of the ones in the chat. Regarding deadline, the deadline is the 30th of January, 2026. And now I'm going to go through some of the questions that we brought up that I think Asta could maybe speak a bit deeper into. So we had a question, kind of if you could elaborate a bit further, Asta, on giving an example of methodology, the methodology section of the abstract. And I totally understand why that is quite difficult when you have such a short amount of space to really, go in depth about the methodology. And I know Mercy and Lisa at the start provided very good insight around, not having to go into depth about what a specific analysis entailed. But Asta, could you maybe speak a bit more on that?
Of course, of course. So I can speak on it in terms of what I usually put within the methodology section of an abstract. So I usually start off with, if it is a quantitative study, I usually start off with what my sample size was and who my population was. So we recruited 1,000 adolescents from urban poor communities in Kinshasa, DRC. So that becomes my first sentence, you know? So again, think about the population. So that covers the population. Then we go into the study design. And the study design, we say, between the ages of amongst these adolescents, we followed up over 5 years and remained with a sample of 800 adolescents. So that demonstrates that you are doing a longitudinal analysis, and it says what the loss to follow up was, right? And then I go into what were the methods that I used, you know? So I say, depending on what my dependent variable was, if it was peer violence experiences, I would say I used a multinomial logistic regression to understand how agency affected peer violence experiencing amongst these populations. So those become the 3 sentences as part of my method section. And in fact, if you want to make it shorter, if you want to put more emphasis in your results, one of the things you could do is say adolescents from 10 to 19 years 10 to 14 years were recruited from urban poor communes of Kinshasa, DRC in 2017. By 2022, we had 800 adolescents who were followed up consistently over time. To examine the relationship between agency and peer violence experiences, we conducted multinomial logistic regression. And that becomes your method section then.
Wonderful. Thank you so much, Asta. And also just to touch on the point around methodologies, because this was a question that appeared a few different times, you can submit both qualitative, quantitative, or mixed methods approaches. Brilliant. Thank you so much again, Asta. Also, just to say as well, there's been a lot of questions about sharing the recording or the slides. The recording will be shared afterwards on SVRI's platforms, and then our platform, the GVRCN.org website, which I'll pop again in the chat, will share the presentation slides specifically. There's also some questions around sharing successful abstracts from the past. So just keep in mind that SVRI is a small team. So if there is one that you're interested in particular, you can look at past programs and reach out to SVRI directly to see if they'd be able to share that abstract from the author. So just keep that in mind. Yes, Asta.
We also, the GVCN did get 2 to 3 abstracts from people from last year's forum. And so when we are posting our recording, we can post those abstracts as well.
Absolutely. Absolutely. Thank you so much. I'm just going to have another little look here because we've got another 2 minutes for a question here. Scoping reviews will be accepted, absolutely. And also just to say there's a lot of questions around if certain topics are able to be submitted. And I think it's really important to highlight that, you know, if it's important to you and your community and exists within this field in some realm, it's really important that you do submit and you do share the work with us so that SVRI can potentially include it in next year's forum. So do submit the work. And yeah, I know SVRI and the rest of the reviewing team are very excited to see what the field has been working on and wishes to present. We have one more question that I'll take from the chat, and this is should the background lead to gaps in the specific study population or lead to gaps more generally in the study topic? Then we can bring up the study population and the methods. Great question.
That is an excellent question, and you have so many different gaps. And I think one of the things that I would encourage you to do is think about, rather than limiting the gaps to a place or to a population, think about what it is that is not in the field generally, and think about how your results answer those questions, and frame it based on that. So I would ask you to do both. So think about all the different research gaps, and then think about which gap is most required to answer the so what question, because in the end, it is all connected, And if you are able to make a compelling so what and your implications, then everything else fits together.
Great. Thank you so much, Asta, for that. And just a couple last minute points for some other more logistical questions that have been asked. No, there is no participation certificates offered for the SVRI forum. And also feedback regarding unsuccessful abstracts is also not possible at this time just due to the size of the team. However, this is something in future iterations of the forum that we hope to explore the possibility of. Yeah, so with that, I'm going to go ahead and start closing out this session. I just want to thank everyone so much again for joining us today, for being here, for learning from us, and for sharing your knowledge, your background, your interests. It's been wonderful to have all of you here today. Thank you so much to SVRI for helping co-host this alongside the Gender Violence Research and Collaboration Network. We've posted a sign up to our newsletter link in the chat as well. And thank you everyone so much. Best of luck with your submissions, and we really hope to see you at the forum next year. Take care, everyone.
Patricia's hand is up.
Thanks, everyone.
Thank you. Take care, everyone.